Andrew Farlow is a senior fellow at the Oxford Martin School in Oxford and joins us now from the city in the UK. Andrew Farlow, good to have you on the News Hour with us. Now, as we said, India and Iraq, two stories that we just brought you there, just reveal how healthcare systems can be brought low by this pandemic. What can be done to make healthcare in countries like that more resilient? Is it all about funding?
Well, it isn't. No, it isn't. Obviously, that's there. But actually, if you doubled or trebled or quadrupled the funding, but couldn't deal with the logistics and get things done on time, that's not going to help. Even the vaccines, if they come in the next month or two, it'll take time. The first speaker you had earlier was talking about oxygen. Well, the key thing about oxygen is you need to get that high pressure oxygen in early on in the patient just to stabilize them. And then you can work out what to do with them. And it's that sort of phase of stabilizing them. In the UK, we've sort of learnt that actually you don't need to sort of aggressively treat patients with oxygen for a long period of time. The thing about the oxygen is the patient arrives and the virus is taking up all the space in the lungs, trying to get into the cells, and the ability to exchange oxygen isn't happening. So you need extra oxygen. Now that can be put in place, of course. But one of the things that's happened, for example, in India, is that, as one of your speakers said, they didn't prepare when they had the time to prepare. In fact, this second wave has come along after a period of time when they were letting off the pressure to some degree. Cases had fallen down to about 20,000 cases in about January from a peak of about 90 or 100,000, and you're now up to 300,000-400,000 cases. It surged back. And the system wasn't ready because of the easing back on the logistics and supply chains.
And you mentioned that it's not all about funding, it is about the supply chain and the logistics of getting things to where they're needed. But I do wonder whether sort of health infrastructure in both developed and developing countries is given enough priority by governments.
Well, no, it isn't. The WHO has a scheme where they're trying to sort of make it that there's universal health coverage around the world, a basic set of requirements around the world. And we're falling well short of that globally. This incident has illustrated to all of us just how different parts of the world are connected up, and how the way in which a health system actually operates can actually rapidly reinforce the problem. If you think of the US with its broken up, dispersed health system where there's health insurance and so on, and even a rich country like that has had major loss of life. A country like ours has a NHS with a much better prepared system in many ways, but then the politics gets in the way of that system having its maximum effect.
I mean, you mentioned the UK there, of course. They built those Nightingale hospitals for extra capacity. I mean, in your opinion, was that money well spent?
Well, it's a really good point, actually, and it illustrates and goes back to your first set of observations in this report. When you're dealing with things like potential pandemics, you sometimes have to put some kind of surge capacity, some investment in place that will enable you to be ready for those very rare occurrences when the outcome is terrible. You don't have time at that point to be ready. So to some degree, you actually need more capacity than the system will strictly need on an average day-to-day basis. So I wouldn't criticise, and I haven't seen enough data to criticise, the politicians for putting those hospitals in place at the time. Bear in mind that we can always, in all of this activity and responses to the pandemic, we can always look back with the benefit of the hindsight, with the benefit of the data and the evidence we've got now. When they did those decisions, what evidence did they have and what was the best evidence? Going back to India and Iran, and indeed to the UK and other countries today, we've had a year of learning and having lessons thrown at us, and still we're not learning the lessons. These places are particularly, as you know, being impacted by new variants of the virus, which is doubling up the problems that they're facing because they haven't got their populations vaccinated yet, which of course is a whole nother ball game and a whole nother discussion point for another day.
Absolutely. I do wonder then finally, Andrew, if we can sort of dig into those lessons that may have been learned. As you rightly point out, we are well into this pandemic now. I guess it's a very fluid situation. This is the first time this generation's had to deal with something like this. What lessons do you think will be drawn out of this in the future?
Well, that's interesting because we've just set up a global health strategy group between the UK and Europe and the Global South to look at lessons from the pandemic. I think one of the things that I learned is that countries that at the start of the pandemic were rated really high in their potential performance against the pandemic actually did pretty badly. That's the US and the UK. So it doesn't matter, how much on paper you look prepared if your leadership and your politicians and all the rest of them can't actually pull behind any of these schemes. Also, at the very start of this pandemic, the number of times people said to me, and politicians were saying, it'll be over by, and then they would name a number like 12 weeks or 14 weeks. I said to my colleagues, this is easily a 3 or 4 or 5 year struggle on our hands. And as it's sort of rolled along, and some countries have got relatively more on top of it than others, it's becoming clear that another lesson, a big lesson, is we really have to pull together globally. These problems, if they're in one part of the world, affect all parts of the world. And I'm sitting in the UK, and there is a little bit of, to some degree, celebration. We're on top of this. But we are as vulnerable as other parts of the world. We will find that new variants of the vaccine come along, new variants of the virus come along, and the vaccines will have efficacy and protection for a while. So the global connection, the need to coordinate, the need for investments in place in advance of events, and the fact that logistics and getting things in early and not leaving all the decisions so late in the day, these are critical.
Absolutely, preparedness is the key. Okay, Andrew Farlow from the Oxford Martin School, thank you for that analysis. Thanks for being with us.